Hi, my name is Greg. As new public health professionals for San Bernardino County, you are about to embark on a career that is filled with many challenges, but many great rewards. In order to understand the challenges you face, the work that needs to be done, and how to effectively pursue the ultimate outcome of improving the health of the people of San Bernardino and the state of California, it is imperative to understand how public health has evolved over time. As senior level epidemiologist in the San Bernardino Department of Public Health, we are going to highlight a few of the historical events that are the bedrock of the field of public health. Keep in mind that public health has evolved over the course of three primary areas. Public Health 1.0 that occurred in the late 19th century and focused on public health efforts at the population level. Public Health 2.0 that came about in the late 1980s that was driven by events such as the creation of the Belmont Report and the establishment of the National Research Act. During this time period, the 10 essential public health services were established that are the foundations that guide what we do today. Today, we have found ourselves in the era of Public Health 3.0, where the focus is on the community level and the interconnectedness on the necessity for a chief health strategist, stakeholders in the community, our educational system to help produce credentialed health professionals, evidence-based data, and funding sources. We begin today's discussion in the evolution of public health in the late 1840s with Dr. John Snow. Snow is a pioneer in the field of epidemiology and public health. His work related to the cholera outbreak in 1848 was probably his most significant contribution. In his book on the mode of communication of cholera in 1849, he suggested that cholera was caused by an agent that was able to replicate itself and infect people when ingested via contaminated water sources. Snow was able to take this assertion and test it in 1853 by conducting a cohort study testing sewage-contaminated water and uncontaminated water sources drawn from the Thames River. His study was conducted near his home in Soho in London, where there were over 500 deaths caused by cholera. What was most astute and what gained him notoriety in the field of public health was his use of geographical mapping of the local area to isolate the source. His intellectual ability to isolate a water pump source that was contaminated helped to save lives. This breakthrough in the field of public health has contributed to research today at all levels, local, state, and national, when it comes to finding a source of an outbreak or how to control the spread of disease. The information ascertained from mapping can be used like Snow did in the 1850s to convince the local council to remove that water pump handle, which in turn saved lives. Today, as public health professionals in San Bernardino, we use mapping resources such as ArcGIS to illustrate the public health concerns related, like the impact on pesticide use on a local community. We can also use the information we obtain to work with federal agencies and partners like the CDC to prevent and control outbreaks. Jimena will now explain to us how another public health issue related to typhoid in the 1900s continued to lay the foundation to our field of work in public health.
Hi everyone, my name is Jimena and I'm going to be talking to you about Mary Mallon and her relevance to public health today. Mary Mallon is commonly referred to as Typhoid Mary because in the early 1900s, she was determined to have caused at least 122 cases of typhoid fever. Now I'm going to switch topics a little bit and give you some information about Salmonella typhi, which is the agent that causes typhoid fever outbreaks. The National Institute of Health states that Salmonella typhi is spread mainly from person to person through fecal and oral contact route. And it's important to know that people could also be asymptomatic human carriers and they could spread the disease. This is very important knowledge because Mary Mallon worked in kitchens. In fact, in many of the kitchens in which outbreaks were reported. As an asymptomatic carrier, Mary didn't have a reason to believe that she had an infective agent inside of her or that she was spreading this disease to others, which is why when George Soper, who was investigating the Salmonella outbreak, linked Mary Mallon to these infections and asked her for a sample of her stool, she shooed him away and refused to cooperate. Soper pleaded his case to the New York Department of Health and the police department, and they helped him to obtain the sample that he needed. Through this sample, Soper was finally able to prove that Mary Mallon was the asymptomatic carrier of Salmonella and was responsible for the infections of all the people at the different households in which she had worked throughout the years. As employees for the San Bernardino Health Department, it is imperative that you understand that something as simple as washing your hands with soap and water when handling food can go a very long way in preventing disease transmission. Up next, we have Kiara, who will be talking to you about the Food and Drug Administration.
Hello, ladies and gentlemen. The Food and Drug Administration, also known as the FDA, first began with the passage of the 1906 Pure Food and Drug Act, which was recognized as the United States' first major food and drug safety bill. This bill was incorporated to prevent the manufacture, sale, and transportation of misbranded or harmful foods, drugs, and medicines. Today, the FDA regulates approximately $1 trillion worth of products annually and employs 14,000 employees to inspect the production of food and drugs, as well as search for new technologies to improve inspections. If applying for a job at the San Bernardino Health Department, applicants should be aware of all the ways that the FDA plays a role in the local health department in the following way. First, all food businesses such as restaurants, prepackaged food stores, wholesale food manufacturers and distributors, food trucks, vending machines, and ranches that are involved in the selling or preparing of food products must submit an application through the San Bernardino Health Department for a health permit. Second, food handlers who work in San Bernardino County are required to obtain a food handler's card. However, in order to obtain a food handler's card, food employees must go through training and receive proper certification through the Public Health Department. And finally, the San Bernardino Health Department is involved in local clinical operations, and one of their primary focuses is immunizations. Therefore, it is extremely vital to the Public Health Department that the FDA only approves drugs that are safe for the public, because the Public Health Department is the one who will inform local citizens about which immunizations they need during certain seasons of the year or for other medical purposes. Next, we will have Amanda inform you about the U.S. Environmental Protection Agency.
Action to keep the environment safe for the health of humans is a key concept in public health that gained prominence in the public health timeline in 1960. Land, air, and water pollution concerns regarding issues like oil spills, chemical contaminants, and pesticide use, which is common to the San Bernardino County, were gaining widespread attention in the public eye. Concerns over topics such as deteriorating air quality, debris littering natural areas, and dangerously contaminated urban water resources led President Nixon to address a 37-point message to the House and Senate in 1970 regarding the environment. Some important points to note were focused on requests for funding to improve water treatment facilities, cleaning of facilities harming the air and water, ending the dumping of waste into the Great Lakes, plans to further safeguard oil transportation on the seas, treatment plans for oil spills, and the development of research, standards, and strict guidelines for improving air quality and lowering motor vehicle emissions. President Nixon also went on to create a council that would take part in organizing federal government programs designed to reduce pollution, so that these programs could effectively meet the goals that he set about in his message on the environment. With this council's recommendation, President Nixon proposed a plan to Congress that would put the environmental responsibilities of the federal government in the hands of one agency, which would become the Environmental Protection Agency, also known as the EPA. The EPA would have better capabilities in terms of many of the items listed in the president's message, like research, monitoring the condition of the environment, setting and enforcing standards for air and water quality, individual pollutants, and waste disposal efforts, and financial and technical assistance, as well as training for pollution control programs in the states. After hearings conducted that summer, President Nixon's proposal was approved by the House and Senate, and today, the EPA has a hand in ensuring many efforts to meet their mission of protecting human health and the environment. To accomplish their mission, the EPA develops and enforces regulations, gives grants, studies environmental issues, builds partnerships, educates the public about the environment, and provides essential information to support their mission further. The formation of the EPA and its efforts have been essential to public health because the EPA protects our environment to protect the health of the public, ensuring a future for the public that is thriving, healthier, and cleaner. Finally, Lindsay will inform us on the ethics of research.
Ethical research is extremely important for all public health professionals. All of us expect to be treated ethically when we visit a doctor's office. Imagine what would happen if you walked into a doctor's office and were told you were going to participate in some sort of research study. You had no choice in the matter, and the doctor wouldn't tell you what would happen to you, how long it would take, or the reason the study was being conducted in the first place. You would probably feel intimidated, scared, and confused. Obviously, this would never happen in the United States today without major legal consequences. But people did experience this kind of treatment in unethical research studies like the Willowbrook hepatitis study, the Tuskegee syphilis study, and medical experimentation on prisoners in World War II. After the unethical treatment of the participants in these studies was discovered, it became apparent that standards needed to be placed for ethical research. The Belmont Report was published in 1979 by the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. It requires strict ethical treatment of all human subjects in research, including ethical treatment in three main areas: respect for persons, beneficence, and justice. Respect for persons requires respecting participants' decisions about their health and providing protection for people who are unable to make sound decisions about their health. Beneficence demands that researchers do not harm participants and provide maximum benefits and minimal harm. While working for the health department, your responsibility for each patient or client is to connect them with the most beneficial resources that our department has to offer. Justice requires fairness to all participants by distributing burdens and benefits of research into 5 categories. 1, to each person an equal share. 2, according to individual need. 3, according to individual effort. 4, according to societal contribution. And 5, to each person according to merit. You are expected to treat every person who uses the services of the San Bernardino Health Department with fairness, ensuring no favoritism due to race, gender, socioeconomic status, or any other social determinant. It is every public health professional's duty to treat research subjects according to the ethical guidelines outlined in the Belmont Report. Respect for persons, beneficence, and justice are the 3 main areas of ethical conduct. Incorporating these principles into your professional practice will ensure ethical treatment of all patients. We hope you have learned a lot from the timeline events and this presentation. Components of Public Health 1.0 and 2.0 played important roles in the development of today's Public Health 3.0 practices. Understanding how public health has evolved will help you make informed decisions about current public health issues, recognize the importance of creating community and organization partnerships, and use ethical principles that developed over the last decade for treatment of participants in any research. As employees of San Bernardino Health Department, you are an integral part of the next public health movement. Thank you.